Hello, everybody. This is Dr. Adil from United Kingdom. I'm fellow of the Royal College of Surgeons of UK and 35 years experience as a surgeon and teacher and trainer. There has been a growing evidence that SARS-CoV-2 or COVID-19 has been extremely confusing, not only for the governments, but also for the scientists, health professionals, and public because of various signs and symptoms different from the respiratory symptoms. In March 2020, the government website said COVID-19 is no more high consequence infectious disease. Similarly, on the website of the public health government, the same message was delivered that COVID-19 is not highly consequence infectious disease. But people were confused and labeled it as a hoax when after a few days, the lockdown was implemented on the United Kingdom on 21st of March 2020, which resulted thousands of elderly patients being transferred from main hospital into the nursing home, where 78,000 elderly patients died due to neglect, isolation, dehydration, and depression. Similarly, the doors of the hospital were closed for the patients and their relatives. And most of the patients having chronic heart or lung diseases, diabetes, hypertension, they died at home because of fear of coming to the hospital. These precious lives could have been saved in a well-planned treatment with the specialist hands in the hospitals. I witnessed that millions of patients, they lost their opportunity for their investigations and treatment, especially the cancer patients in the early stage, which always shows better results if treated by screening or early treatment. All the elective outpatient clinics and theaters were cancelled, and 99% referral from the GPs were seized off. I was part of the emergency team working in North Manchester General Hospital as a consultant general and colorectal surgeon, and dealt with serious emergencies with or without COVID test positive, taking all the precautionary measures recommended by the NHS, and saved many thousands of lives. I discussed with my colleagues regarding the suffering of patients due to closure of the doors of the hospital for the elective patients who were supposed to come for their investigations and treatment without any positive results. That prompted me to go on the social media, and I released a couple of videos regarding COVID pandemic and its far-reaching effects on the public, personal and private lives, on economy, and on children having disability and underprivileged community. I was targeted by the trust, and on 22nd of April 2020, I was dismissed by Jonathan Moss, medical director of the North Manchester Hospital Trust, without any warning, show cause notice, any disciplinary procedure, or any notification. Due to my viewpoint of COVID pandemic and its related effects on the public and patients. I had no clinical, ethical, social, or health issue whatsoever. I went to another trust for a locum post in Pilgrim Hospital, Boston. After third day, I was treated exactly the same way by medical director of the trust, Dr. Neil Hepburn of United Lincolnshire Trust, with immediate dismissal because of my primary videos on the social media where I expressed my viewpoint on COVID-19 without having any clinical or patient-related issue whatsoever. On 25th of May, I received a letter from GMC that I was being investigated because of 4 online complaints by 4 anonymous members of the public regarding my viewpoints in my videos over the social media. GMC used abbreviated for these unknown complaints like Mr. Andy, Mr. SH, Mrs. KK, and Miss SP. The GMC asked me to appear before the interim order tribunal of the GMC on 1st of June 2020. I cooperated with the GMC and went for the hearing on 1st of June, where I was suspended for 12 months without any justification, apart from my viewpoint on COVID-19. I had no other complaint related with the patients or health whatsoever. On 26th of May 2021, GMC further extended my suspension for another 12 months without any justification whatsoever, and then referred my case to the Medical Professional Tribunal Services, which is part of the GMC. Recently, I have been through Medical Professional Tribunal hearing, which was scheduled 12 months ago by the GMC to prolong my suspension order. So this hearing started from 13th of June 2022 and lasted until 1st of July 2022. GMC alleged that my videos on the social media might have harmed my patients, and my videos might have damaged to the safety of the public and brought disrepute to the profession. During the hearing process, I requested to the GMC to produce 4 complainants who generated initial complaint against me regarding my viewpoint of COVID-19 in my videos in April 2020, which resulted into 12-month suspension order by the GMC. And the 2 medical directors who dismissed me without any show cause notice, warning, are following the disciplinary procedure as per NHS rules and regulations, which they violated, and unfairly dismissed me. But GMC refused to produce those witnesses. I requested to the chairman of the Medical Professional Tribunal to order the GMC to produce these 6 witnesses for their testimony to prove them to be true witnesses. But my request and application was rejected by the chairman of the Medical Professional Tribunal, which was totally unlawful, outrageous, and discriminatory. During the trial, I requested again and again to produce those 6 witnesses, including 2 medical directors, to come for their fitness on oath to testify them, but they disregarded my requests. At the end of the Medical Professional Tribunal hearing, the chairman of the tribunal wrote in his final decision that Mr. Adil had no concern related with his patient care, and he has been very experienced, qualified, and skilled surgeon, and there has not been any complaint whatsoever. Secondly, Mr. Adil does not have any health, probity, or any other antisocial charges whatsoever. However, we are suspending Mr. Adil for another 6 months because he seems to have lack of insight and reflection, which was totally bizarre. And I questioned to the chairman and the GMC barrister that tell me the yardstick of the insight and the reflection which I should follow for getting back into my patients, which were waiting for me to treat them, but they couldn't give me any answer. This was totally unfair, unjustified, outrageous, discriminatory, and totally victimization of me for 2.5 years by the GMC and by the MPTS. My case has been taken to the High Court by my expert legal advisors, PGH law firm, Mr. Philip Highland, and world-renowned criminal barrister, Mr. Francis Hoare, for the justice and the damages which I and my family have been through for 2.5 years including damage to my reputation, my career. I lost my job and total loss of income and livelihood. That affected my family and children with a devastating effect and created a lot of stress and anxiety, which we are going through. I have full faith on the UK High Court justice system, and I'm looking for justice in the High Court against the draconian and biased action of the GMC and Medical Professional Tribunal. I need your kind moral and financial support to contest my case in the High Court. As you know, it cost fortune to fight for justice, although justice is delayed, but it has not been denied yet. That's why I'm very hopeful to win this case and to make an example for the regulators to change their attitude towards the health professionals, especially the highly qualified, experienced, and skilled health professionals belonging to ethnic minority who are considered to be backbone of the NHS in many ways, and their contribution should not be ignored or forgotten. This is a time when millions of patients are waiting for their investigations and treatment. According to the NHS figure, there are 10 million people on the waiting list, and NHS says it will take 10 years to clear the list. On the other side, the regulator and the NHS are victimizing the highly qualified professionals who are capable to do and clear all the operative, endoscopic, surgical, and medical work. Therefore, I would request to the government and the higher authorities and the justice system in UK to make justice and change the Medical Act 1983, which has been terribly abused and misused by the GMC while sitting in a public office. Just Giving crowdfunding have created a page for your kind donation and support in order to contest my case in the High Court. I am most grateful. You have already been very kind to contribute your valuable assets and money for the justice. And your donation would be extremely helpful to fight back for the sake of justice. In my case, for myself and my family who have been suffering a great deal of the injustice for the last over 2.5 years. Thank you again for your help and listening to me. Best wishes, Dr. Adil from UK.